Hello, my name is Kate. I'm a certified athletic therapist here at the Pain and Performance Clinic, and today we're talking about hip impingement. So hip impingement is also known as femoroacetabular impingement, or FAI. With this injury, patients present with some stiffness or pain in the hip, sometimes into the groin, their bum, or even their low back. The main complaint with this is a pinching feeling front of the hip, so that hip crease, and it's felt during movements where we're bringing that hip into its end ranges. It's like a deep squat, going upstairs. Some patients even would feel this during prolonged periods of sitting or during sports that would involve a lot of change of direction. This type of injury involves the hip joint and can have changes in the bones of the hip joint. So your hip joint is made up of your femur and the pelvis, and so this forms a ball and socket joint. So the femur, the head of the femur, is the ball, and then the acetabulum is the socket, so they fit in together. There's three different changes that can happen with CAM morphology. That is where there's changes to the head of the femur, so that ball portion. Pincer is more changes to the socket, so the pelvis part. A mixed morphology would be a combination of the two. With all these three, they affect how well that head of femur moves within the hip joint and can cause a bit of that pinching feeling. Treatment-wise, there is conservative management or there is surgical management. Now, conservative is recommended as step one. Surgery can be used, but in patients that have had the conservative management versus surgical, at the 2-year mark, outcomes are the same. So conservative is recommended. With this treatment, it involves your physio and your exercise rehab with the goals of determining your baseline level of tolerable activity, so how much and what activity you can do that is comfortable, and then we just focus on gradually increasing this to get you back doing what you love. We also work on improving the overall range of motion in the hip joint and strengthening the muscles around the hip. And this is done through the exercise rehab, which overall helps to decrease that pain and stiffness and get the hip moving. If you would like to know more, you can visit our website at painandperformanceclinic.ie, or you can send us an email at info@painandperformanceclinic.ie.